I'm Dr. Caileigh Pudela, and I am a pediatric, adolescent, and young adult hematologist oncologist at MedStar Georgetown University Hospital. I specialize in treating patients with cancer and other blood disorders. My philosophy when it comes to the treatment of my patients is to provide the best care possible, and that means so many different things. I want my patients to feel empowered to be able to make medical decisions, or their parents to feel empowered to make sure that they know everything that is going on and can really contribute to their own care. And I want to follow the most recent scientific literature to make sure that I'm providing the most up-to-date care for my patients. And so importantly is that I really want to be able to make sure that I'm treating the whole patient and their whole family. So I really pride myself on providing well-rounded care where I think about everything that is going on with the patient and not just the cancer, but the patient as a whole. I decided to become a pediatric oncologist because I think this is one of the most incredible fields that there is in medicine. One, I love taking care of children, and I love getting to be a part of their family. And two, I love being a part of some of the most advanced research that's going on. I think that the pediatric community as a whole has done a really incredible job of working together across the country and across the world to make sure that we are doing absolutely everything that we can be doing to make treating cancer more effective, to provide better outcomes for our patients, and to reduce toxicities once we know that our patients are responding to their chemotherapy and other treatments. There's so much that's incredibly exciting about the future of pediatric oncology. As we move forward, we're starting to focus on more targeted therapies for our patients that hopefully have fewer side effects, rather than focusing on fast-growing, rapidly dividing cells that traditional chemotherapy focuses on. We can start to look at the very specific targets on cancer cells and try to provide better outcomes and treat cancer better. The best thing about my job is my patients. I love getting to see them every single day. I love getting to be a part of the families that come in here and trust us with their care. It's really, really amazing to see them on the other side doing well, getting emails and letters and Christmas cards from our patients who are doing really well after we've provided them care. I also love my colleagues. They all provide excellent care and are wonderful human beings, and I'm really lucky I get to work with them. When parents come in, they always want to know what caused my child to have cancer. Was it something that they did? Was it something that their child did? And the answer is usually there's nothing that they did, the child or anybody else involved, that caused the cancer. It's not contagious. They didn't catch it from anybody. It's really not their fault. What happens is and cancer is a term for a whole group of disorders and diseases, and it has to go down to the level of the cell. Cells make up every tissue in our body, and a cancer is a cell that is growing and dividing abnormally and really gets out of control. And that is due to the genetic material of the cell. And a cancer happens or develops when somehow there's a mutation in that genetic material or DNA. And it's not anybody's fault. It just typically is bad luck that somehow a mutation develops and cells keep growing and get out of control and take over and don't let the normal or healthy cells do their job. And so it's one of the first things that we do is reassure our patients and their family that there was nothing that they did wrong. So once we diagnose that a patient has cancer, whether that's a bloodstream cancer or a mass that we're concerned for cancer. There are any number of tests that we have to do to determine the exact type of cancer and what risk status or what stage of cancer the patient may have. And that involves additional blood tests as well as additional imaging. That could be an MRI, an ultrasound, a CT scan, a PET scan, and it could also include a procedure like a bone marrow biopsy or a biopsy of the tumor, depending on the cancer type. So first, we have to figure out the exact type of cancer before we come up with a treatment plan. So here at MedStar Georgetown University Hospital, patients might be treated inpatient in our hospital, or they might be treated in our clinic in the Lombardi Cancer Center, or it could be a combination of both. Additionally, some of our patients are able to receive chemotherapy at home or receive treatment at home. One of the reasons I came to MedStar Georgetown University Hospital was because it was really important to me to be able to be a part of a large multidisciplinary team who's really treating the whole patient as well as their family. And so we have a very large team here to help treat our patients. There's the attending physician who is specialized in pediatric and adolescent oncology. They've typically done about 6 years of training beyond their medical school training and are the doctor for that patient. We also have a nurse practitioner who has an advanced degree and provides wonderful care for our patients. In addition to that, we have so many other members of our team. We have our social workers who join on and really help our families navigate some of the complexities, like taking parental time off of work to be able to be there for their children during treatment. Our pharmacist makes sure that we're giving the exact right treatment and medications that help relieve any side effects of the treatment. Our case manager also helps us deal with insurance and any other issues that may arise. We have wonderful nurses in our clinic, a wonderful front desk staff who always greets and manages all sorts of problems for the patients. Some of the most important members of our team, especially if you ask the kids, are our art therapist who comes up with brilliant projects to help distract our patients during treatment in the clinic or while they're admitted inpatient. Another really important member of our team is a child life specialist who really helps kids understand and deal with a really tough diagnosis and helps them prepare for things like procedures or just being in the hospital and having to see a lot of people every day. We're also really proud of our integrative medicine team, who especially focuses on helping adolescents and young adults during their treatment. That includes a massage therapist and acupuncturists who provide acupuncture and acupressure to help alleviate some of the symptoms of our patients' therapy. We're just really excited that we have such a large team who all has the same goal as the patient and the family, which is getting them through their treatment and doing it with as much grace and as few side effects as possible. We have so many support services for our patients, and that is what is very important about oncologic care. It's not just about the doctors and the nurse practitioners who are guiding them through their treatment, but the other people who are helping them tolerate their treatment and make sure that they continue to thrive. And so we have physical therapists, occupational therapists, and speech therapists who help our patients. We have our social workers and case managers. We have art therapy and child life specialists. We have integrative medicine with acupuncturists and massage therapists. And then the other people who support our whole team include the important work of our radiation oncologists, our radiologists, our surgeons, as well as our colleagues on the adult medicine side. We all work together and collaborate together to make sure that our patients are really well taken care of. When parents and children come in, the most important question they have is, what is going to happen? And our goal is the same as theirs. Our goal is to cure every child of their cancer diagnosis so that they can go on and live a long and healthy life. So we carefully balance our treatment plans to get rid of their cancer while keeping in mind expected side effects to try to limit any sort of toxicity from the treatment that they're getting. In the future, once patients are done with their therapies, we actually transition them to our survivorship team. Once you're a cancer survivor, we continue to follow along with you and make sure that we're looking out for very special potential side effects, while also being so excited to watch our patients grow and try new things, join new academic clubs, go off to college, join sports. Those are all things that we really look forward to and love to do here. Treatment can affect every child in a little bit of a different way, and every treatment is different for every different type of cancer. There are some times when kids aren't going to feel very well while they're getting treatment, and they might actually have to be admitted to our hospital and aren't able to do too many activities. But then there are other times when kids are able to go to school and see their friends and see their family members and are actually feeling pretty good. So it all depends on the type of cancer, the type of therapy, and where exactly you are in the course of your therapy. But there are often days when you're feeling really good and are able to have a lot of fun. When kids come in, a lot of times they have a picture of what somebody with cancer looks like. A lot of times they've maybe seen a grandparent or an aunt or an uncle, or even somebody on TV who's had cancer, and they have a picture in their head of what side effects might be. This is something we talk very carefully with them about so that they can manage what their expectations of their treatment course will be. All the side effects are different depending on the type of cancer and the treatment plan that we have. But some of the most common ones are feeling very tired and having your blood counts be low based on the treatment plan. And so being at a risk for an infection or needing transfusions of platelets or red blood cells. Oftentimes, some of the chemotherapies will cause nausea and vomiting, but we do our very best to provide other medications to prevent those sorts of side effects. I think one of the biggest ones that people see is that it can cause hair loss. And it's important to note it's not the cancer itself, but the treatment that can cause hair loss, because it targets cells that divide very quickly and grow quickly, like your hair cells. And so that often happens, but hair does grow back after therapy. And in the meantime, we encourage kids to do whatever it is that they want to do, whether that's dyeing their hair or completely buzzing it off or getting a wig. There's all sorts of ways that we can help our patients cope with that. One of the really incredible things about treating pediatric cancer is that we have gotten really good at it for some pediatric cancers, and that's all because of the really strong clinical trials network that we use all across the country and all across the world. The Children's Oncology Group is the main pediatric cancer clinical trial group in North America, and we are a member institution of the Children's Oncology Group. So often we do have clinical trials that are available to our patients so that they may receive some of the more cutting-edge treatment opportunities. There are many available, and it's one of the first things that we think about when a new patient comes in. Is there a clinical trial that we can use that can potentially either provide a better outcome or even reduce treatment toxicity? Pediatric cancers are a little bit different from adult cancers. People often hear about the need to screen for cancers that arise in adulthood. That's typically not the case for pediatric cancers. However, there is one exception in that there are some genetic conditions that do put children at risk for developing cancers. And those are typically thought of when there's a strong family history of cancers. In which case, if those are known, then there are often labs and imaging tests that are done to try to catch any cancer that might develop early on. Most of our patients and parents ask, what could we have done? What could we have done sooner to have found this cancer sooner? And most often, we're not going to be able to tell them the exact time that the cancer started to develop. But often when we see our patients, they've done exactly the right things. They've gone to their pediatrician for feeling tired or for noticing a lump. And their pediatrician has often sent the right labs and sent them to the emergency department or called us really early on. And so we often find that that time doesn't really make a difference, and that our families have really done the best that they could in identifying what's going on. Families should bring their children to MedStar Georgetown for their child's oncologic care because we do a tremendous job of treating the whole patient. We really care for our patients, and we do it with the latest literature, the latest science, and just an incredibly large and welcoming team of individuals who are so good at their each individual tasks to really make sure that we're thinking about everything that a patient and their family needs during their oncologic care.